Welcome to this explainer. I am truly so glad you are here with me today. Everywhere we look in our culture these days, we hear the word narcissism. It's become, well, just a very common label to throw around. But today, our goal is to look deeply beneath that cultural buzzword, you see, to find the actual clinical truth. We are going to look at the iceberg of narcissism, and together, we will uncover the hidden vulnerability that lies so deep beneath the surface.
Okay, let's dive into this. We have a clear journey ahead of us. First, we'll move beyond the buzzword. Then, we'll explore the grandiosity and hidden vulnerability, recognize the key signs, uncover the roots, and finally, look at how to offer support, both to them and to yourself.
All right, section 1, beyond the buzzword. Society uses the word narcissist so freely today. Often, it's just used to describe someone who, say, takes a few too many photos of themselves. But honestly, this is a dangerous trap of misunderstanding. There is a very clear dividing line here. On one side, we have healthy self-esteem. Think of it like a deeply rooted tree. It's completely normal and healthy to accept your strengths and limitations and feel good about who you are. But clinical narcissism, it's fundamentally different. It acts more like a rigid suit of armor, an unhealthy, desperate strategy just to cope with any perceived threat to that self-image. To make this really concrete, we have to look to the clinical diagnosis of narcissistic personality disorder, or NPD. The DSM-5 outlines some very specific criteria here. We're talking about a grandiose sense of self-importance, a constant preoccupation with fantasies of unlimited success or power, the firm belief of being entirely special, a need for excessive admiration, a heavy sense of entitlement, exploiting others, arrogant attitudes, and a profound lack of empathy. And remember, a clinician is actively looking for 5 or more of these heavy, rigid traits to actually make an official diagnosis. Moving on to section 2, grandiosity and hidden vulnerability. I invite you now to look below the surface of those bold behaviors we just talked about. So, the crucial point is this: an impairment in regulating emotions is at the true, absolute root of pathological narcissism. What we perceive on the outside as this golden, unbreakable mask of grandiosity is actually hiding a profoundly fragile self-image, one that relies entirely on external validation just to survive. And this leads us to how it is actually expressed. We so often incorrectly think of grandiosity only as a roaring lion, right? That overt, in-your-face arrogance and entitlement. But narcissism can absolutely be covert, lived out internally in quiet motives, feelings of severe inadequacy, and deep shame. Individuals with NPD actually oscillate between these two states. That arrogant, overt behavior you see is very often a frantic, desperate attempt to conceal a covert core of shame. Let's look at section 3, recognizing the key signs. Understanding this deep internal pain really helps us recognize the traits in everyday life, and this brilliantly illustrates the day-to-day reality. The disorder essentially fractures a person's life in 3 main areas. First, their self-perception becomes entirely ruled by insecurity and an extreme sensitivity to criticism. Second, interpersonally, that lack of empathy just isolates them, making it so hard to maintain relationships. And third, emotionally and behaviorally, they experience high emotional reactivity, like intense anger when their needs aren't met, along with poor impulse control. It literally fractures relationships across the board. Now, we absolutely must speak with deep empathy about the complications of NPD, because this diagnosis rarely travels alone. It frequently co-occurs with serious substance use, severe mood disorders, hostility, aggression, and tragically, a much higher risk of death by suicide. These compounding struggles make the internal pain very, very real and incredibly heavy for the individual carrying it. Section 4, roots and risk factors. To truly grasp this condition, we have to understand where it comes from, and the research points to a tragic irony in early childhood. You see, both extremes of parenting can predict narcissism. On one end, you have parental overvaluation, just excessive, constant praise that isn't grounded in reality. And on the exact opposite end, you have parental coldness, severe abuse, and deep rejection. The tragedy here is that both of these extremes completely fail to teach a child healthy, stable self-worth, effectively freezing this fragile personality structure right into place. There are a few additional risk factors at play here as well. Narcissistic individuals may actually have genetic predispositions to the condition. We also see that this disorder often occurs alongside other personality disorders, like antisocial or borderline personality disorder. Furthermore, research shows it tends to be more prevalent among younger adults. Now, what's really interesting about this slide is the exact data on the gender breakdown. Research has found that the lifetime prevalence of narcissistic personality disorder is 7.7% in men. Compare that to a significantly lower 4.8% in women. It is a notable difference, and it's something that our field continues to study very closely.
Let's move to Section 5, Supporting Them and Yourself. If you happen to have a loved one navigating this diagnosis, how do you manage? My friends, supporting someone with NPD is a beautiful, compassionate goal, but it is deeply challenging. First, educate yourself. Communicate acceptance of their illness. Encourage them to seek treatment, but please hear this clearly. You absolutely must set firm, healthy boundaries and prioritize your own mental health. Remembering that their behavior is their responsibility is paramount to your own survival. Finally, Section 6, How Psychology Can Help. I want to end with a strong message of clinical hope. While there are no medications specifically designed for personality disorders, psychotherapy offers a very real path forward. Long-term talk therapies are the key here. Things like transference focus therapy, which helps safely integrate those positive and negative self-perceptions, and schema focus therapy, which works on adjusting those deeply ingrained, enduring early life beliefs. Together, these approaches can create a safe space for the individual to actually process that deep-seated shame. But remember, psychology doesn't just treat the individual, it treats the whole ecosystem. Psychoeducation is absolutely critical for you, the family members and friends. Psychologists are there to help the entire community affected by the disorder. They can help you understand the vast complexities, set those vital, healthy boundaries we talked about, and develop highly effective coping strategies. As we conclude this explainer, I want to leave you with a final thought to carry with you today. How can we possibly balance profound empathy for a loved one's hidden pain with the absolute essential boundaries needed to protect our own well-being? It is a very difficult balance, my friends, but a vital one. Thank you so much for walking through this journey with me today. Continue to learn, protect your peace, and take good care.